All right, welcome. If you're here, you're getting ready for your practical assessment with Paul from the First Aid Garage, and we're going to get you tuned up and ready to go. Think of this as your personal prep session. We'll walk through the big stuff so when you get to your assessment, you'll feel totally confident. Let's do this.
Okay, let's just jump right in. Picture this. You find a child, they're on the floor, and they're not responsive. That little jolt of panic starts to hit, right? But you're not going to panic because you have a plan. So, what is that absolute first move you make? The answer to this really is the key to everything else we're going to talk about. So here's the situation, an unresponsive child. The real secret here isn't just remembering a bunch of steps. It's about having a simple, clear plan that you can fall back on every single time. That's what keeps you calm. And that's exactly the plan we're going to lay out right now.
Okay, before you even think about rushing in, I want you to pause. Your number one job, and this might sound a little crazy, isn't actually helping the child. Not yet. It's to protect yourself. You have to do a quick scan of the area. Is it safe for you? I'm talking traffic, fire, anything that could make you a second casualty. 'Cause you're no good to anyone if you get hurt, too.
Okay, now for the good stuff. This is your master plan, your go-to checklist for any unresponsive person. It's an acronym, DRABCD. And honestly, this is the most powerful tool in your first aid toolkit. It takes all the guesswork out of it and just gives you a clear road to follow.
So, what on earth does DRABCD stand for? Well, it's just a simple way to remember the really life-threatening stuff you need to check and in what order. So we've got danger, response, airway, breathing, CPR, and defibrillation. Let's tick off the first few right now.
All right, let's run through these. D for danger, we just talked about that. Check. Once it's safe, we're on to R for response. You get down, you tap their shoulders firmly, and you shout, really shout, "Are you all right?" If you get nothing back, we move straight to A for airway. We've got to make sure the path for air is clear. And you do this with a simple move called the head tilt chin lift. One hand on the forehead, tilt it back. Fingertips of the other hand under the chin, and lift. That's it. That simple action can literally save a life.
So, the airway is open. But is any air actually getting through? This next step is absolutely crucial. What you find here is going to determine everything you do next. And to check for breathing, you need to remember 3 little words. Look, listen, and feel. You get your head down with your cheek close to the child's mouth. You look down their chest for any movement. You listen for breath sounds, and you feel for any breath on your cheek. Now, a really key point. Sometimes you might see weird gulping gasps. That's called agonal breathing, and it is not normal breathing. If you see that, or if you're in any doubt at all, you have to act as if they're not breathing.
And you don't have forever to do this. You have to be decisive. You look, listen, and feel for no more than 10 seconds. That's it, 10 seconds. And then you have to make a call.
And this is it. This is the big fork in the road. The answer to this one question, yes or no, sends you down 2 completely different paths. So let's go down path number 1. What do we do if the answer is no?
Okay, you've checked for 10 seconds, the child is unresponsive, and they are not breathing normally. This is a cardiac arrest. The clock is officially ticking, and we need to act fast. First things first, shout for help. Make a scene. If anyone's around, point right at them and be specific. You, call 999 and find a defibrillator. Now, step 2, and listen close, because this is a key update for 2022. For kids, we always start with 5 rescue breaths. Not compressions, breaths first. Get a good seal, pinch their nose, and give 5 steady breaths, just enough to see that little chest rise. Then you're straight into CPR.
So what's the rhythm? You need to lock this number in your brain, 30 to 2. It's 30 chest compressions, then 2 rescue breaths. 30 compressions, 2 breaths, over and over and over. And for a child, you want to push down about 5 centimeters deep, which is about 1/3 the depth of their chest.
And how fast do you push? Well, think of it like this. You're trying to get the engine running at just the right speed. The target is between 100 and 120 compressions a minute. You know, a great way to keep that rhythm is to hum the song Staying Alive in your head. The beat is pretty much perfect. Now, CPR is great for keeping blood and oxygen moving, but it probably won't restart the heart on its own. For that, we need our jump starter,
the AED, or Automated External Defibrillator. The second that machine arrives, you stop what you're doing, turn it on, and just follow its voice prompts. It'll tell you exactly what to do.
Okay, putting the pads on right is critical, and it's different for infants versus children. For a tiny infant, so anyone under 1 year old, you put one pad right on the front of their chest and the other one on their back. For a child over 1, you use the standard adult placement, one on their upper right chest, the other on their lower left side. The pads themselves usually have pictures on them to help you out. Okay, let's hit the brakes and rewind. Back to that fork in the road. What if you checked for 10 seconds and the child is breathing normally? They're still unresponsive, but they're breathing. This is a totally different situation. We do not need CPR here. Our only job now is to protect the airway that's already working.
And again, the technique is different based on their age. For an infant under 1, we're not going to roll them on the floor. Instead, you'll carefully cradle them in your arms, making sure their head is tilted slightly downwards. This just helps any fluid drain safely from their mouth. For any child over 1, we're going to use the classic recovery position on the floor.
Let's walk through that roll. It's a really simple 5-step dance. First, you kneel beside them and put their nearest arm out at a right angle. Second, you bring their other arm across their chest and just rest the back of their hand against their cheek. Third, you lift their far knee up so their foot is flat on the ground. Fourth, you just gently pull on that knee and they'll roll right over towards you. And fifth, you just make a little adjustment to their top leg to make sure they're stable, and you tilt their head back one last time to keep that airway nice and open.
All right, we've gone down both roads. You know what to do if they're breathing, and you know what to do if they're not. You've got all the key info you need for your practical. So let's just do one last quick-fire recap to really lock it all in.
This right here is your whole decision-making tree. Unresponsive? You use DRABCD. Check for danger. Check for response. Open the airway. Then the big one. Check for breathing. If the answer is yes, they go in the recovery position while you wait for help. If the answer is no, you shout for help, give those 5 rescue breaths, and start that 30-2 cycle of CPR and use the AED. It's that straightforward.
And here's one final piece of pro advice. If you ever find yourself in a really chaotic scene with more than one person hurt, your gut will tell you to run to the person who's making the most noise. But you have to fight that urge. The quietest person might be quiet because they're unconscious or because they can't breathe. They're almost always your highest priority.
So look, you've seen the whole process now. You've got your diagnostic tool, DRABCD. You know which parts to use from your first aid toolkit. You are way more prepared for this practical assessment than you probably feel right now. You have the knowledge. You have the plan. The only question is, are you ready to be the person who steps in and makes a difference? I think you are. You've got this. Now go and smash that assessment.